Yo,
Diretamente da Almeida, daqui é
this is
Capeverdean.
crazy. New levels, new levels. The whole crew's on that new level. Yeah. What's going on, CV World? This is your boy Millie, back with another episode of Praçazul. I'm here, of course, by my side, my hosts, my guy, Gomes.
What up?
How we doing today, bro?
Good.
Feeling good?
Chilling. Always.
And of course, we have the one and only Keila Gomes in the house. KK, what's going on?
Good, and you?
I'm good. Guys, we have a very amazing and very important show today. Our guest today is a mental health and addiction counselor in the state of Massachusetts. She's been doing that for over a decade now. In the recent years, she has also added psychiatric nurse practitioner to her already impressive resume. Here today to talk about mental health climate in our community and, of course, in our CV culture. We have the one and only, very patient, very smart, Angela Andrade in the house today, guys.
Hey, everybody. Thank you for having me.
How are you doing, Angie?
I'm good.
You okay for us calling you Angie?
Yeah, that's fine.
Yeah, definitely. All right.
Most people know me by Angie.
Oh, that's good.
Angela is the professional, but we're all friends here.
We're all friends here. Thank you so much for coming to the show. We've been talking about this for a while, you and I, on just on social media, going back and forth, just finding the right time for you to come. And I think this is the perfect time. It's like so many topics out there, so many examples in our community here and in CV of things that are just horrible things that are just happening. And hopefully you can give us some clarification about what's going on.
I will try my best.
Try your best. I know that you were born in Santiago. Mm-hmm. Tell me where in Santiago.
So I was born in Santiago, Gomes, to be exact.
I've never heard of that one.
Tevis,
Where is that
Gomes.
exactly?
That's like on the way to Somada, Tarrafal.
Okay.
You have to pass
Okay.
You have to go through Gomes, the best town.
It is?
In Santiago. I'm obviously biased, but
a great spot.
it is a great spot. For people of Gomes, we are very proud of Gomes, and we represent it well wherever we are. So
Nice.
Never heard of it.
I
yeah.
never heard of it either. Give
yeah.
me an artist.
A lot of
Give me
people
an
don't.
artist that's from there.
I have a couple of uncles that sing and cousins.
You're gonna tell me that Gotti is from there or something. I was like, wait a minute, okay. All right.
Probably is.
I know. So how long did you live in Cape Verde before you came here?
So I came to the U.S. when I was 11.
Okay.
Came in the middle of December, winter months, and it was freezing.
Oh, wow.
And obviously I wanted to go back for a little bit, but eventually got adjusted like all of us. And
Yeah.
yeah, so I've been here since 11 years old.
How did you get rid of the whole accent? Like there's not even one bit of it in there.
Oh, it comes out,
It comes
especially
out.
when I'm angry or like passionate. The accent does make its entrance once in a while.
Okay.
But my father married an American, so my stepmother's American.
Okay.
So I learned English right away
really
because
fast.
I was forced to speak English. She didn't speak Creole.
Okay.
So in our house, actually, we spoke mostly English.
English.
Yeah.
So
That's actually
explains-
good.
Yeah.
You went to elementary school in Cape Verde. Mm-hmm. And till what grade did you go?
I think I was like 4th grade because I started fifth grade in the U.S.
In the U.S.
Actually, no, I came mid 5th grade.
Remember
So
that
yeah.
when you come like in December, the school year already started on September. So
But my stepmother, because she was proactive, we didn't stay behind.
oh, okay.
So we were able to pick up. I came, myself and my brother. So we were able to pick up where we should have been. So I was never like a year behind or delayed with school because of that.
yeah,
Did-
that's good.
Did you notice the difference? Like a lot of people say that it's so hard in Cape Verde, like school, and then you come over here and it's like, this is it.
Honestly, I was, not to brag, but it was easy.
It was easy,
The
right?
material came
Same thing,
easier
yeah,
for
I thought
me.
the same thing.
My grades were top notch because of that, because a lot of the things that we were learning. So I came in 5th grade. It wasn't until 6th, 7th grade that I was learning the stuff that I had already learned in Cape Verde, especially for math.
Crazy.
That was like my
That's what
Mr.
I hear a
Laytown.
lot.
Shout out to Mr. Laytown. He like
Laytown.
was very patient with me.
Mm-hmm.
And yeah, I feel like I was more advanced because of that.
That's not that. But that's unfair, right? We have a country like Cape Verde, like no people don't respect the education over there. Yet it's like so much. I don't want to say stronger, but
It's harder.
because
it's
they-
harder than here in America. And the kids that come from school there, they're usually already caught up. I've heard a lot of examples like that. Went to school, then went to Brockton High.
Went to Brockton High for 4 years, and
Okay.
then after Brockton High, went to Bridgewater State.
Oh, nice.
That's where I got my bachelor's of psych, and so I double major in psychiatric and psychology and social work. And then following that, I went to Cambridge College for my master's. So that's where I got my first master's,
Nice.
mental health and addiction counselor.
Okay.
And I graduated Cambridge College in 2007.
Wow.
And then I worked as a mental health and substance abuse counselor for a little bit.
In Brockton?
Yeah, I mean, I worked
All
everywhere.
All around, yeah, sure.
I've been everywhere
Sure.
in working areas. And then I worked at Brockton Neighborhood Health Center, actually. That's where I had my legit introduction to the capeverdean population as a mental health and substance abuse counselor. And honestly, that like opened my eyes to the needs on the community, like of our community. Because up until that point, you know, you're in school, you're around other kids your age, and you're not necessarily introduced to the hardships of your community. I think working as a mental health and substance abuse counselor with Brockton really like opened my eyes to, wow, mental health is definitely something that is not discussed in our community. Definitely something that I want to learn more about, but I also want to educate myself more about.
That's amazing, though. But that's not just Cape Verdean culture. That's all cultures are in there.
I say Cape Verdean because I'm able to speak Criollo, Portuguese. A lot of my patients, because we have to meet language. Obviously, if you meet a counselor that is able to speak your language, it's like half the battle in terms of like establishing rapport with a patient or trying to understand, because our culture is very interesting and difficult at times when it comes to navigating the mental health, right? You have to be very careful in testing the waters and not saying you're crazy.
Yeah, exactly.
You know, certain words that would trigger certain
Yes,
things.
that's definitely
So
Make them feel offended. And
exactly, people are easier to offend, especially the older generation. So you have to really tread lightly on establishing rapport. And I think that's why, you know, having the language ability is important.
I think I think it already opens up just the fact that you're Criollo. I know my mom, whenever she speaks to, let's say, Brancos or white, you know, it's a total different conversation. I don't know why. As soon as she starts speaking to somebody in her language,
Yeah.
it's like she trusts it.
Yep.
Yeah,
And
more
it's because of probably the things that they went through when they were growing up. You know what I mean? When it comes to this mental health era that we are in right now, like, first of all, I'm extremely happy that the focus is on mental health in this era. You know, I think that it helps a lot. When I look at myself, it made me understand, especially like my parents more, you know, the people that came before, especially the women in my family, the women that raised me. You know, I could really look at them and be like, oh, okay, I understand that. You had to like hide all these emotions because of traditional values or whatever,
Right.
you know? So I always take two stands on it. One stance is I definitely what do you call it? Show empathy. Is it empathy?
Yeah.
Yeah. Empathy towards people with mental health. That's like about 70-75% of my stance with that. Then there's another 25% of me that I feel like I feel like I'm the hardest working guy in the office. You know how that feels? You know what I mean by that?
Yes.
So you go to the office, you're working, you have your personal issues, but you go on time, you work hard, you don't complain too much, and then you have coworkers that are calling out every other Monday, coming in late, lazy, complain, and you're like, dog, I'm going through the same thing as you, but I'm fighting. So my question is, how do you know when somebody is being real, like having a real issue with mental health, or somebody's just being straight like lazy? I struggle with that a lot, and I hate to one day be like the last drop in somebody's cup to spill over, you know? So how do you
Yeah.
do that?
So, I mean, for me and my line of work, I usually don't see patients or people. They don't come to me when they're happy, right? I'm there to help them get better or improve whatever circumstances they're going through. So I usually see people at their lowest when they're trying to hold on for so long and try to, maintain and trying to keep the day going. And then all of a sudden they can't anymore because they're either too depressed or too anxious and when you say lazy, I always go by like, okay, is it personality? Are their personality just genuinely laid back, not really somebody that's a go-getter, like if it happens, it happens, if it doesn't happen, okay? Or is it like they've been so depressed for so long that they don't have the extra motivation to try a little bit harder?
Yeah.
It's a fight to even like roll out of bed to get to work.
Exactly.
You know what I mean? There's levels to depression. The longer I've been in this field, the more I realize there are a lot more people that are depressed and they don't even know that would meet the clinical criteria for depression that they wouldn't even know.
Wow.
So when somebody's describing somebody as lazy, I'm like,
No, so what I mean is, I mean that all metaphorically. I'm not talking about inside of the office. I'm talking about in life.
oh, in life.
You know what I
got
mean?
you.
So I feel like I would feel in the office. I'm
Yeah.
like, okay, I have 3 kids at home.
Yeah.
I have this at home. I have my issues at home. But I come and I fight and I go and I go and I go. And then some people come to the office and they have no kids at home and they have the little issues and it's complaining. And it's usually those people that are getting promotions. And you're like sitting there like, and I mean, that metaphor in like then in
But maybe
dealing
they
with mental
fighting-
health.
They're
But we
fighting
shouldn't
different
be
battles.
comparing,
You know what I mean?
comparing stuff like that.
They
Yeah,
might be
I feel
fighting
like it's
different
not fair.
battles. Like maybe what's important to you, like, oh, I have 3 kids and I have all this responsibility.
Yeah.
For them, it's a different type of, they have,
Yeah.
I don't know,
Have a
maybe,
different
oh, my pool,
goals.
my pool is dirty. You know what I mean? So maybe that's
what I
what's stressing them.
That's what I mean. That pisses me off.
Yeah, but
So,
that's
let me-
their issue. You know what I mean? You know what I mean?
So
It's tough.
everybody's
comparing, I just say
issue
it.
is real to them.
Yeah.
Exactly.
So for you, it may be like you're extra motivated because you have an extra responsibility at home and you know you have to try hard because you have mouths to feed, right? So if somebody doesn't have kids, and this is just an example, they have real issues as well. It's just that your motivation and their motivation is completely different.
Completely different.
So a perfect example for me, I deal with patients that are going through some serious stuff, like losing housing, molestation, depression, all of the above,
Divorce.
right?
Yeah.
Divorce, like real life issues in my job now.
Addiction.
And then addiction, right? People losing family members, all of these bad, horrible things that I hear every single day. And then I have friends calling me and saying like, oh, Angie, I like can't book this trip, or like I don't have the money, or you know what I mean?
have a flat tire.
I have a flat tire today. Or this is just an example.
That's
'Cause
what
my
I
friends
mean,
are all
yeah,
they
yeah.
all know what I do and they're very real with their issues, but it's real to them, and you have to show empathy for whatever is they
them.
think is real to them. I cannot compare. Yes.
Do I?
But really,
So this is what empathy is,
Yes.
right? You have to kind of put yourself outside of your perspective, outside of your
Yeah,
shoes.
yeah. It's tough.
let's be honest. We talked about this so many times. I cannot tell you, like,
Still being learned.
somebody's maybe their problem is not your problem. So why did you pick psychology and describe psychology?
Okay. So the first question, I actually wanted to become a psychiatrist and so in high school, Mr. Roman, I remember all my teachers that were very influential to me. So Mr. Roman was what was he? Like a counselor at Brockton High School. And I think it was my junior year that we started exploring colleges, options, and blah, blah, blah. And we got to shadow a teacher. He was an adjustment school counselor, and I got to shadow him for the day. And I was like, amazed with what he does throughout the day. And just helping the kids in Brockton High, there's a lot of kids back then, a lot of kids that were into violence and all of these things. And we all hung out with Mr. Roman's office because he was the teacher that everybody felt comfortable to disclose and go through stuff. So he actually motivated me to go into psychology. Well, psychiatry, and I started looking up med schools and all of that. I'm like, oh, I as an immigrant, a child of an immigrant, there's no way I'm going to be able to afford that and all of that. So I decided to go the route of psychology and social work because of it was a second option actually, but it turned out to be the best option, the better option for me.
To do the started, right?
To be this, yeah, because
Starting.
medical school, one, I wouldn't be able to go as far as I would because I would financially,
Yeah.
I wouldn't be able to afford it. So it's one of those things. And then psychology is just a blend of studying the mind, right? So there's different types of psychology in different areas. But as a mental health counselor, my job is pretty much strictly in dealing with patients that have mental health issues. And there's different types of mental health issues. We use the DSM. I don't know if you've ever heard of the DSM. It's a Diagnostic Statistical Manual, which is like the Bible
Wow.
for
That's
everyone
a
that
Bible.
started. It's like our Bible, right? That's a book that has all the criterias for patients meeting the patients that have any illness. We open it up and we're like, all right, what are your symptoms? Do you have low mood, anxiety? Do you have anhedonia? Do you have like crying spells? Are you seeing or hearing things? So based on that guidance, we make those diagnoses. You hear people say, "Oh, he's bipolar," just because somebody
That's
because
like
they're.
the biggest word
It's
ever.
the biggest misconception, and honestly, as a provider, it like irks me when somebody's already labeled bipolar when they're showing some sort of emotion or too angry or too, because there's so many other perspectives and things that we have to abide by based on our manual, the Bible.
Do you have any advice for people that's that's in high school right now and they trying to go to psychology?
I mean, you really have to know if that's what you want to do. It's not for everybody. It's a hard field. I mean, we were talking earlier about, working out as my coping mechanism. And the reason why that's my coping mechanism is because my days are stressful. Like I said, I hear a lot of negative. People don't come to me when they're happy usually. Actually, when they feel better, they were like, "Oh, I don't need you anymore." You know what I mean? I usually see people at the lowest of their low, and they tell me some things that sometimes their family members don't know.
Yeah.
So my days can be very hard just hearing that every single day, taking that negative, and I'm very the boundaries, right? Where to not take you home. I have kids, and I don't want my bad day affecting
How do you
them.
balance your mental health with
Right.
that?
It's a daily balance, a daily struggle. One way is my outlet. I found fitness as my coping mechanism.
Talk about how important is fitness, not only for the body, but definitely for the mental
health. I
part.
prescribe it to all of my patients.
Yeah.
When I say prescribe it, when I have my patients, I don't treat just their symptoms. I talk to them about everything, their physical health, the importance of managing their diabetes and their blood pressure.
That's really important.
The importance of eating healthier. Whatever we consuming and putting in our body is going to affect how you feel. So if somebody's coming to me depressed and they're eating unhealthy foods, that's going to make you more depressed.
Yeah.
If your blood pressure and your sugar levels are out of whack or they're not stable, that's going to affect your depression and how you feel. So when I talk to patients and I educate them, it's not just about the medications that I'm prescribing to them, but I spend most of my time talking about eating, talking about things that you could do for yourself, like going for a walk 30 minutes a day. You know what I mean? Trying to get out of bed every day, getting some sunlight, talking to one person instead of hibernating in your house. I spend a lot of my time, believe it or not. A lot of people say, "Oh, you go to the doctor and you just get meds." I'm not that type of provider. My thing is usually I say, you definitely need somebody to talk to. I don't know if you guys follow me on social media, but I'm always saying everybody needs therapy.
I was actually going to ask you
therapy.
that.
I always recommend therapy for everybody because it's not just for people that have any mental health issues. It's you having a hard day. Just I came here and talked to you. You could go and just develop that information to your therapist and go home feeling lighter. So it's not just the medication. It's a combination of things that you could do. And I spend a lot of time like educating my patient about fitness, exercising, eating healthy, things that have worked for me personally. I'm always advocating for that.
So how is it to be a woman in this nursing profession?
Listen, I've had my struggles, right? Especially being of color. Right now, not so much because I work at Brockton neighborhood and there's a lot of us. So I don't feel so singled out anymore. But my first job as a psych NP, I worked somewhere where I was the only Black person in the office at that time as a Black provider. And people always like, okay, you were saying I look young. So people always underestimate me, right? When they get when I call my patients in the office, they always like, if I'm taking their blood pressure or
You're
if I'm,
talking about the patients or the people that you work with?
so both actually.
wow.
Yeah, a lot of people until they meet, they're like, "Oh, you're Angela," like because I don't know. People have when they come in to see a provider, they have a different perspective. Perfect example. I saw a bunch of patients, new patients during COVID. And during COVID, we were working mostly telehealth. So I didn't meet any of my patients, actually. It was a lot of it was phone, right? And right. So when I actually, after the whole, COVID, and we started going back into the office, I started meeting a lot of patients that I had treated for like at least a year over the phone in person. And they are like,
It's you.
"Oh, it's you."
This is at
That's,
NHC?
yeah. They're like, "Oh, you're not what I expected."
That's
Yeah,
even that compliment suck.
right.
I
It's like-
hate it so much.
I call it like a backhanded
Even
compliment.
when I was like when I was like an operations manager and I was doing the work, I'd be like, "Yo, you're really good. Like you're black and you're really good." Like that's how it feels sometimes. You're like, even their compliments is like, "Yeah, you're good for a black guy,"
Yeah.
like something like that. It sucks.
I mean, I get like, "Oh, you're so young. There's no way you have the qualifications to do what you do." Or I get like,
Have you
"Oh,
been
you look
told
different."
that before?
Yeah,
Oh.
yeah, that I look so young and there's no way. Yeah.
Yeah. It's
Yeah.
tough.
I had patients said, "Go get a psychiatrist. You're not a real doctor. You're a nurse practitioner. You're not a real doctor." Which is honestly, that's how you tease them out. Like patients that are actually going to have rapport and respect you, and because it takes both ways, right?
I've heard of this before. Yeah.
Yeah.
Being a woman is already tough. Being a woman of color would be tougher. Yeah.
That's
When
my
it comes
question.
to the difference between young men and young women, they don't struggle the same. I would think, right? What are typically like the things that and let's just keep it in our culture, in the CB culture. What's typically like the things that young men struggle with?
So a lot of my patients, by the time they get to me, they're either very, very depressed, and anxious, and very angry. I have a lot of angry men.
Oh wow.
Angry because when you come from one country and then
Identity.
you're working and then things are just not matching up. You're working 2 to 3 jobs and you still can't pay your rent. Or you're having medical issues that you feel like it's not being heard. And then you have people in Cape Verde, if they leave family in Cape Verde expecting you to work and send money. Like all of the responsibilities could be too much for someone, right?
Yeah.
And again, a lot of Cape Verdean men don't acknowledge mental health. Let's be honest, that's a conversation for another day.
Yep.
But they don't acknowledge mental health. So by the time they get to me, they're so depressed. A lot of my time is actually convincing them that's depression. Because they think like, "Oh, I'm so estressado. Stress. That's how men usually say they're depressed. I'm just stressed. And then I say, "No, you check all the boxes for depression. Do you know what that is?" Different. Like they will fight you to
So
the nail.
we can't be that weak.
Yeah. And then I've had patients just flat out leave my office and then come back months later like feeling worse. Or even worse.
So they say like, "Oh, you're right." So,
Yeah. And patients are like, "Oh, I didn't realize that was depression. Thank you for, because it's not just medications. I have a lot of patients that I assess and like we try to come up with a plan and they don't go with the plan that I'm suggesting because a lot of them think, "Oh, se não toma remédio me dodo, oh, remédio tá fazendo mal." I have a patient right now who was doing well on his medications and he thought he was better. He was like, "Oh, I'm going to ba Cabo Verde, tomar banho na Mar Preto." Eles falam que ela tá cura tudo.
Oh wow.
What happens? He went to Cabo Verde and then was off his meds and decompensated. So a lot of my struggle when it comes to Cape Verdean men is trying to actually convince them that there is a mental health issue going on and it's not just stress.
And how about young women?
So for young women, they're easier.
Yeah.
It's easier to talk to, especially I think when it comes from hearing it from another woman. I think it's easier and they're more receptive. A lot of the symptoms is different. A lot of my Cape Verdean women patients are very somatic, like, "Oh, tenho dor na cabeça, tenho dor na barriga." It's more somatic symptoms. It's not like flat out like, "I'm, so tired, I can't do anything."
Yeah.
So the symptoms sometimes change, but it's easier to talk to women than men, for sure.
That's crazy.
Do you recommend them to therapy? And
Yes.
because you're saying that, but how, especially the men's. Oh yeah, because I agree with you. I always say everybody needs therapy. I don't go to therapy, but I know I should. Remember we had this conversation? Yeah, of course.
I appreciate your honesty.
No, I'm honest. Like,
I think you need therapy. No, I don't know. Ask her.
I didn't ask you.
No, you've told me. Oh, okay. I was
No.
just joking. But
Anyway,
I guess we
so
can't
I'm
joke
saying
too
that,
much
like,
today.
you know, because again, me and him, we always have this conversation about mental health, and I told him back in the days, I was like, I think everybody needs a therapy, and he's like, nope,
I don't agree.
I don't agree
still
at all.
You don't, yeah,
So,
yeah.
because like you said, therapy is not just you're depressed or whatever. You just
No, I do think that should be out there. Everybody needs therapy. I don't totally agree with it because I feel that, like, if I'm looking at myself, like but I also know I'm a very fortunate person. I have my mom, dad, stepmom, stepdad. Every friend I ever had, I still have. I could still call. I could call you.
No, you
We
can't.
open up to each other.
No, we don't.
We open up to each other.
No, we don't.
What are you talking about?
Joking.
We open up to each other all the time.
Friendships are
And
being
I have,
tested today.
I have, Cobb is a very good friend of mine. I have a bunch of friends like that, right? I have my wife that I have a very good connection with that I can express. I have my kids that I can talk to and they'll be like, "That what are you talking about?" I'm like, just listen.
Millie, the key
but-
thing that
but
you
the
said
professional-
there is that you're very fortunate.
Yeah, exactly. A lot of
There's
people don't
lot
have
of
that.
people that don't have that or don't
Exactly.
even feel confident or comfortable
To open up.
To open
opening
up
up
with
to
them.
family members.
Exactly.
Yeah.
Exactly.
And you probably, I mean, I'm speculating and I shouldn't, but there's also level of things that have happened. There's level of trauma.
True.
There's some trauma that you disclose to family members and it makes the family dynamics worse.
True.
And the reason why I say everybody needs therapy, it's not because you're fortunate and that's great, but there's certain things that your family shouldn't be predisposed to because sometimes that changes the dynamic of a relationship, right?
Okay.
So if I'm having a bad day, yeah, I could call my brother, my sister, but the conversation I would have with my significant other would not be the same conversation I would have with my brother, or the conversation I would have with my father or my mother. So there's levels to things that we feel comfortable with sharing with different people. So a lot of patients that have been traumatized, sometimes they open up the trauma to the family and it gets swept under the rug.
Yeah.
That makes it worse.
That makes it worse. Yeah, for sure.
Or they get told, oh, that didn't happen.
Yeah.
They get challenged, right?
Especially with our parents. Our parents have
especially the
amnesia.
parents.
Yeah.
Our parents suffer from it. And I never put a hand on you.
Exactly. So those what I'm saying. Like, so sometimes you have to tread the waters lightly on how to open up to traumatic events to your family members or how to disclose certain things
True,
to
true.
family members.
No, but that's what I mean. Like, I feel that I have that channel for everybody. I would never go up to my mom with certain things because I
Right.
know for her I have to go
Yeah.
for hugs or all that
Yeah.
stuff.
Yeah.
If I want to have this conversation, I'm going to go to Cobb. If I want to have this conversation, I go to
Yeah.
my wife. If I want to have this
So
conversation.
you know where to go to.
Yeah, exactly. And I'm
Yeah.
fortunate enough that everybody's here.
Right.
If I had to live in a world without my mom and my dad, I would probably go to
Yeah.
therapy. You
But
know
don't
what I
you
mean?
think it's something that one thing that, let's say, you can't tell none of us, and you can't tell a professional. No,
I don't
like,
think so. I don't-
Okay, you know what I mean?
You know what? I
You know what I
think
mean?
that
Like-
everybody in a lifetime will somewhere need a therapist. Let me just say that.
Oh, okay.
Right?
Yeah,
Because
definitely.
one day, my mom is not going to be here. And I'm like, going to be what?
Yeah.
You know, that's going to be tough. I'm going to have to talk about
And
it.
that's
Yes,
what
a
I
lot to do with
mean. When
trauma. Yeah.
people come to us, usually when something's happening.
Something's already happened.
Not when
yeah.
things are going well, which is great. But usually we see patients when, they're going through a divorce, they lost their family members or unexpected loss of a parent's huge, loss of a child, God forbid, is huge. All of these things, that's usually when I see a lot of patients come in.
All right.
So how do you determine the type of medication for your patient when they have like multiple mental issues?
That's a good question. It's patient specific. So there's in mental health and psychiatry, there's a lot of different type of medications for different things. But sometimes, the book may say this medication is for this thing, and then we treat it off label for something else. It's very patient specific, and no medication works the same way for every single patient.
That's true.
You know what I mean? I have like what I say, oh, my go-to that may work for you for depression, and then Millie will come in And I said, oh, Millie, this worked for this patient for depression, and it won't work for him. So it's very patient specific. I usually I try my best not to do multiple medications at one time.
Okay. Test the water like for one, and then
Especially for patients who've never taken any type of medications. You don't want to mix up too many things at one time because of allergies, because of, there's different things that could happen. So we do an assessment, a detailed assessment, especially about medication, allergies, and all of that. Depending on the symptomology, there's categories for medications like the SSRIs, which is mostly for depression. There's the antipsychotics for patients who are psychotic, hearing, seeing things. So there's different class and categories that we get to choose from. But just because one works from one patient, that doesn't mean it's going to work for the other. So sometimes we may have to do off-label things, kind of be a little bit more selective and mix it a little bit. But my philosophy is the less medications the patients are on, the better.
Oh,
Good.
that's great that you think like that.
That's my philosophy. I mean, all of them, anything you put in your mouth has side effects. I always go, when I do my medication education and spiel to my patient, I say, listen, any medication that I'm going to give you has side effects, especially when I'm treating my pregnant women, because there's a lot of people that are pregnant and depressed, and they still need the medication, right? And then it's not you just not treating the women, there's a baby inside of them. So you have to be very careful of the type of medications and how we always do risk versus benefit. Is it more riskier for you to be very, very depressed to the point where you're suicidal and can actually hurt yourself? Or is it better for me to treat you even though you have a baby? You know what I mean? I'd rather you be alive and not kill yourself and have this baby as healthy as we can, right? So we always talk about the side effects, risk benefits, but I usually try my philosophy is the least medication you're on, the better for me in monitoring, but also the better for you in side effects and other possibility of things happening.
Okay.
And also, how do you deal with the situation where a patient refuses the treatment?
Happens all the time. I say, patient autonomy. It's your right to refuse medications. This is what I'm recommending. This is what I think will work for you, but it's not my treatment plan. Usually what we advocate is patient is in control of their life. I have a lot of patients that do well on medications and they think, oh, I'm cured. And then they get off of medications. And then they're right back to a point way when they started.
And also you can tell when they stopped, right?
Oh, yeah. Okay. Oh, yeah.
That usually happens with older capeverdean. Like my aunt is like, okay, we won't say her name, but I have an aunt that's the same thing. And every time it's the same way. She gets to a point, I'm feeling better, I don't need it. And then the thing is, to start it over, you can correct me if I'm wrong, to start it over takes like weeks and weeks and weeks for it to start working again. So that whole time that in between, she's going to be all depressed again. And it sucks, yo.
And it's like one of the hardest things for me to see is a patient that's been doing so well on their meds, and then it's like they forget how they were before the medication. They get like all of a sudden they forget and they think, oh, I'm doing so well, let me completely get off of medications. So I always advocate for, if you want to have a conversation about getting off, or you're thinking about getting off of medication, have a conversation with your doctor. Because for instance, any medications that you're on, your system is used to it. So when you abruptly discontinue it, you're going to feel terrible. And sometimes the symptoms is like 2-3 times worse than it was original.
Do you have patients that you really have to visit at like a psychiatric hospital?
Oh, yeah. I work in a psychiatric. So I have 2 jobs. I should have started with
that.
Okay. I work in an inpatient psychiatric hospital part-time or as needed, more on a per diem basis. Just to continue that, because it's one thing seeing patient in the outpatient world and then seeing them in this inside, right? Really at their lowest. So I try to get a perspective from both, and I like having the combination of both.
It's a good balance.
It is. Because when sometimes you see a patient doing, I'm like, oh my God, I would never want this patient in the inpatient. And then when you see them in the outpatient, they're completely different people. When they have their medications is adjusted, when life is getting better and things, I'm like, wow, night and day. For instance, on my inpatient job, I usually cover the substance abuse unit. And usually when they go in, they're withdrawing from meth and heroin, whatever they're using. And usually they're not, I mean, you're uncomfortable, your body aches, your mood is all over the place, you're not at your best, and they're usually angry, or
They
they're
don't want to shower. They don't want to do anything.
I mean, they're dealing with a lot. So sometimes seeing those patients inpatient and then seeing them in the outpatient where they're actually like stable, their moods are better, their medications are working better, night and day.
I grew up listening to 90s hip hop, right? So Snoop, Pac,
Yes.
cursing, killing everybody on the record. I grew up watching Arnold Schwarzenegger and Stallone and Van Damme kill everybody in the movie.
Yep.
Stand-up comedy, curses, all this, whatever, right? Yet I've never done crime. I've never done any of that stuff, right? So what do you think has the biggest effect on a kid like that? Like for somebody, I always blame parents. But I know it's bad. But is it the environment? Is it friends? Is it bad parenting? Is it hip-hop music? What are we looking
Honestly,
at?
I think it's a
It's a
combination.
combination.
Yeah.
I mean, anytime a kid is brought up in a healthy home, that's a plus, right? You have a starting point, so that kid may be less likely to be influenced because their home environment is stable. But I've known people that had, a mom and a dad, like what I call stable.
Yeah.
We never know what people's lives are
Behind
when they're
doors.
behind closed doors, but what society would consider stable and still get influenced and do bad things
Yeah.
because of their influence, whether it's getting into gangs and things like that. So I think it's always good. I mean, it's giving your kid a great starting point when you have a stable household. You know what I mean?
That's the
and
biggest
then
one, yeah.
when I think that's the key, that's the foundation, right? If we're building a person in the house, the foundation is having a stable household, seeing what a stable interaction is between your mom and dad, or dad and dad, mom and mom. Now we're in that, we have to be very specific, right? Or, and then seeing how life around you.
Because we make our own decisions.
That's
Because
true,
sometimes, and that's what a lot of, not to talk about our people in our community, but a lot of my generation Cape Verdeans that got into had good parents. You know what I mean? The parents
Yes,
that did
that's
the
true.
best that they could with the resources they had, whether it was single moms, single dads, or both. And kids still end up going out and doing whatever they did, right? So a lot of time it's not the
It's not,
parenting.
yeah.
A lot of times it's the influence from outside.
me
It's the
and
type
Cap-
of kid you have.
Me and Cobb, we've talked about it a lot because we're both from, let's say, ghettos of our own countries, right? Like, of course, there's levels to everything. You're from Almeida, bro. Come on, this is just
Ghetto?
I've been there. I've been there.
Wait,
It's really bad.
No, he didn't. We're both from the ghetto.
We both have that. We both listen to hip hop. We both have our vices. We're both from broken homes as well. Our parents, even though our parents are good with each other, we're both from broken homes. You would think that's a recipe for disaster, but yet we never really got into that world. So I always feel like, is there something that triggers the
But
young
it's
mind?
also resilience. For instance, I didn't grow up with my mom, but I grew up with a dad and my stepmom. And I went to Brockton High. In my generation, when we went to Brockton High, that's where a lot of things were happening in Brockton, right? And people are always like, oh my God, you went to Brockton High? How did you manage? I'm like, it depends on the type of kid you have.
Yeah.
You could have a kid that is easily influenced. Thank God I was never into like, oh, let me go out and do this and I was never that type of child. It depends on the child. It depends on your personality. It depends on your resiliency. And I think it depends on how easily influenced you
Yeah,
are, because
yeah.
there are some kids that are more easier to
And I've
influence
heard-
than
Yeah,
others.
I've heard a lot of
So you know
situations.
how you were just saying, like, you blame on the parents, right? But let's say, like, I don't know, like, a dad and a mom, they came from CV with 3 kids, and they leave the house at 7 a.m. and come back at 6 p.m. Right? And the kids go to school. After school, what they're gonna do? They have to keep working, so you don't know what the kids are doing. You don't know who they. You can try to. Oh yeah, you're gonna stay with your aunt or with your uncle, but it can really.
I get what you mean. I get what you
can
mean.
be there like.
It's hard.
Yeah.
I've seen a lot of situations where the parents try.
Yeah.
And I've seen a lot of situations where parents just don't try and give up.
Yeah,
And-
of course.
And I see the structures that they put in their kids, and I'm like, There's no structure. There's not. It's like they don't even care. Let's talk about family and traditional curses in our
Oh God, in our cultures.
in our culture.
Yes, that's the
What can we do better? Like, what things are we doing that are leading, like our traditional ways that are leading, that you feel leads to a lot of miscommunication? I have never been to a place where people live by blood is not thicker than water. Like that in America, I hate that so much. I know we don't eat at the table here as much as they do everywhere else. I know a lot of siblings don't talk to each other, don't talk to their parents over here. Where is that coming from? What can we do to get that better?
I mean, in my day to day, I see a lot of that in my work. So, you know, kids that bring their parents and then things don't go well, or sometimes it's expectations, sometimes it's the cultural differences. I mean, for instance, you can't expect someone who came here when they were younger, who came here with one parent, to have the same bond and connection to the parent that they didn't grow up with, right? And I try my best, because with our capeverdean, older capeverdean, they say, I'm your mom, I'm always right. Or I'm your dad, you're always right. But think it is but to me, I truly believe respect goes both ways.
Of course.
Right? So if you're asking me for respect, I have to respect you.
Of course.
And you have to also acknowledge that the cultural influences here, our culture, the U.S. culture, unfortunately, I think it's a little bit lax when it comes to family, and that's what you're talking about.
Yeah, very much so.
I mean, I could speak about my own family. I have siblings here, and sometimes I'm like, oh man, I haven't talked to my brother in a couple of weeks. That's not.
Good stuff.
Yeah,
That's
you know what I mean. But sometimes we get so caught up in our day to day and our busy lives that we're like, oh man.
But it's not that you guys can't call each other.
It's not that we can't call each other. It's just like that, and that's what I'm saying. The American way is not meant for traditional family the way we grew up with. You know what I mean? So sometimes it's that. And then when you have that difference, you know, people coming and expecting the same sort of family reunion and things like that they would have back home.
Yeah.
Sometimes the U.S. culture is not, or the U.S. lifestyle, it's not even the
Just on
culture.
Thanksgiving.
Yeah,
Everybody gets
the
together,
lifestyle
On
doesn't
Christmas,
doesn't make room for that, right? It's not because everybody doesn't want to. It's just
Everybody's always running.
everybody's running everywhere trying to survive.
As of late, we've had a few topics in CV where, well, number one that we talked about a few weeks ago was the suicide rate in CV is out of control. They're saying that we're in top 15 countries per capita. Now, it's hard for us to fact check something like that. Is that something that you've heard about, or seen, or maybe even been in contact with people over there that happens a lot? And where do you think that comes from?
I mean, suicidality in Cape Verde is definitely getting worse. I think it's definitely something that we've been minimizing and not talking about it more or talking about it enough. Personally, I've lost family members to suicide, and that's why talking about suicide, it's such a passionate topic for me because, you know, I remember when my cousin passed away 10 years ago, I was like, what? Like devastating, right? You would never. So it's something that our family was never even had time to process because it's something that we never talked about. I just now, because of the suicide walk that we just had, I just kind of had a conversation with my mom about that. And she was like, yeah, my sister, it was her sister's son. My sister's never been the same. So we know the impact it has on our family members, but we as family members don't process things like that. You know what I mean? It's something like you're ashamed or you're guilty or there's all sorts of negative emotions that come with it. So nobody really talks about it, and it just makes it worse, and into a point where like it's normalized now. I feel like every other day I hear somebody committed suicide. There was a really somebody who was well known. I don't know if it was like the mother or the grandmother or of the president.
No, really?
Like affiliated, yeah, somebody who was pretty high on and still committed suicide. So no, I always say nobody is immune. Mental health doesn't discriminate. Sometimes our culture actually make it worse for us to come and talk about mental health, because if you come out and say I'm struggling with this and this, you automatically labeled as crazy.
It's weak.
You know, you automatically doido, trindade, like that's the things that says you know what I mean?
Babri Joana.
You know, I always joke and tell Alex, like, we could never retire, or I could never move back to Cape Verde, because there's no job for me in that sense. Because mental health is not really taken as seriously as it is here. Now it's getting better. I'm not going to say it's not taken serious. It's definitely getting better, but it's now nowhere near where it should be.
Do you think social media has influence?
Definitely social media has influence. For instance, if it wasn't for social media, I would not know about the girl that unfortunately lost her life to this guy, right? Who ended up killing himself.
That's happening a lot.
They ended up finding him dead. So yeah, because of social media, I think people are actually talking about it. The younger generation are a little bit more aware, and using the social media platform to spread the word. But unfortunately, it's...
But also the social media is bad.
Oh, well, yeah, it goes both ways, right?
Because social media, like, especially like kids growing up, they really get into the social media and they get influenced and do all this crazy stuff.
I have one more question about that, but I want to get into deeper about what's happening in Cape Verde with the women dying by the hands of their men. And it's always the same, right? Something happens, then the guy kills himself as well after that. Knowing Cape Verdean, that's called a macho man, I can kind of see where that's coming from, right? As a pride thing, it's I think a lot of those situations are also like you're kind of, I don't want to say playing around. You're threatening to a point that you don't think that you're going to get there, and then you get there. But what is it that makes these men like tick and blow up like that?
I always say, again, Cape Verdean, remember when I say a lot of my Cape Verdean patients I see here are angry.
Yeah. At what though?
Build up anger. I mean, there's so many, life in Cape Verde is hard.
Yeah.
Parenting, the way your upbringing, it's easy in Cape Verde. O rapazinho está numa casatar obi, dá culpa. Menino fêmea que está obi, dá culpa. When you grow up getting hit or things like that, you think you normalize. If that's the way parents showed love, and if you're saying you love this girl, psychologically. But I always tell my patients for DV, I mean, by the time it gets to the hitting, that's a little on the too late side. Yeah. Because domestic violence starts with words first. Yeah. It's usually putting you down, calling you names, making sure your self-esteem is low, so you don't leave.
Yeah. Manipulation.
The manipulation factor, right? So it makes you psychologically manipulated by words first until to the point where you don't have the power to leave because you don't think you're going to survive without this person.
Or you're better.
You're worth it even. Yeah.
I've been an asshole in that sense too. Let me correct this.
Please correct this because
an asshole.
It's not going to go well.
An asshole, as in looking at the women in a way, like, why are you still there? You know what I mean? Why do you stay? I have had situations where we got called, me and my guys. Oh, this guy hit me. Went over there, took care of it, and then what happens? Went right back.
Really, the cycle of domestic violence. There's a cycle to it.
Oh yeah.
That first, sometimes women get a little bit of empowerment, and then they think, "Oh, I'm gonna change him," or he's changing. Or sometimes men, and when they see that you're getting a little bit empowerment, and then they start treating you a little bit better, giving you hope that they're changing, right? Yeah. And then the longer you stay psychologically, the more damage is done. Remember, a lot of the cycle is to build to decrease your self-esteem to you're so low when you can't see a way out. Yeah. You don't think like, if I leave him, I'm not going to be better off without him. Wow. So psychologically, you're not in a good space. And that's why a lot of women stay. A lot of women stay because they have kids. If the man is the only one working, how, if you're thinking about your kids, how are you going to survive without them? Those sort of things.
The sorry, I'm not going to do it again.
Yeah, then manipulation.
But I also think that we as men need to step up with that. Because I think that...
But guys, it goes both,
No, but we need to hold the man accountable.
No, what I mean is...
We need to hold our Cape Verdean men accountable.
For sure.
What I mean is men need to hold men accountable. Like if you have a friend that that's doing something like that, that shouldn't be your friend if you're a good person.
So would you call the cops on him?
Oh,
okay,
like on you?
No, I'm saying, let's say you have a friend that just hit this girl, right? What you gonna do? Like you gonna?
I would make him uncomfortable around me about that.
No, I know, but what are you doing for the woman?
I can't call the cops, but there's a lot. Okay, so I grew up in a time where domestic violence was, I'm sorry, it was
Everywhere.
everywhere. Like
So it was normalized.
my
for you.
family, my uncles, okay, I love my uncles, but I'm not going to name names.
Yeah,
But
yeah.
a lot of that was around us. A lot of moms wore sunglasses because something had happened. All of that stuff I grew up around, right? And the uncles would still meet up with each other, would still drink with each other, would still be cool with each other, even though they know that the guy just did a horrific thing or this guy just did something. For me, if Cobb one day called me and said, hey, this happened, I put my hands on Sophia or whatever like that, I would actually go to his house and whoop his ass, first of all. And second of all, I wouldn't want to be his friend anymore. And I would I think we start normalizing that. That starts happening. I think a lot of guys would
No,
be,
definitely.
would,
That's
would move different.
I think it's a thing that until men start holding men accountable, I think it's something that's not going to change because women have been saying this for so long,
Yeah,
right?
yeah.
Help us, help us, help us. It's a cause that, and men don't take us seriously because they think, oh, well, you're provoking it, you're doing this, you're doing that. What are you doing to that guy to make him hit you? You know, always easier
yeah,
to
they
blame
always
the
ask
women.
For what's the reason?
Because
Right.
even if you go to
Right.
go to the police, they most of the times they don't do anything. You know what I mean?
Exactly.
You know,
So
they-
I think
they can't,
it's one
yeah.
of those things
Yeah.
until men start holding men accountable for things like that, I think that's when change will start.
Have you ever dealt with any cases involving gender identity in this new times?
climate.
And I'm trying to be very careful here because I'm still adjusting. Like the thing is with me when it comes to like different things is that I have an opinion, but I know that it needs to be open for whatever we can adjust to, right? So gender identity is that huge in our culture, like in our culture or just around let's say Brockton?
So I'm not right now in terms of patient wise. I mean, I have patients that are not capeverdeans who are like in the midst of transitioning to the different gender or whether it's hormonally or whether it's like just the appearance. You know, it's for me, I also required a lot of training. It's things that in order for me to show empathy, I have to understand.
Yeah.
At the end of the day, human is a human. They're still human.
Yeah.
And this is where the empathy thing comes from, right? So just because it's not something that's affecting me personally, that doesn't mean it is not affecting them. So I always tell patients, you are who you are. You know your body better than any doctor. Whether you choose to be a male or female or whatever in between, you know yourself and you know where your body. So if that's your choice, definitely. But I always inquire and suggest and recommend keep up on top of your, you know, physicals, on top of your everything, right? Just because you're transitioning, if you're a male going from a male to female, you still have male needs, you still have male parts. So you definitely need to go and get those checkups that a guy would get, right? And also, if you're female, the same thing. Your hormones, especially for women in menopause, if you're transitioning, that's things that get out of whack. Just because you're in sexual transitions, you know, these are all things I need to be on top of.
Are the parents supportive usually?
I mean, sometimes they tell me, a lot of my patients tell me they're not, or they're not in a good space with their parents because of, you know, their decision. And sometimes I have patients that are like, yeah, my mom is with him, my dad's not, or my dad's with him, my mom's not. Sometimes I have patients that are like, I just decided to leave home because my parents were not healthy for me in my choices. So it depends on patient to patient.
As a straight guy, right? Watching somebody trans over, or how do you call that? Transitioning over. Watching somebody look at their body and say, okay, this has to go because I want to turn into that. Like, not my first, but there are thoughts of me thinking that's not a mental stable person. Thinking that, like, I could be 100% wrong. But when you, and in your field, when you guys are studying that, does that ever come up as a consideration? Or is it just, no, that's a human being just like everybody else, and this is how we got to treat him?
I mean, again, they come to me because most of the times they are depressed. Most of the times they are anxious. Most of the time there's other things going on that may or may not have influenced their decision. But I take patients where they're at. So in my opinion, a good clinician would start working with the patient where they are. So if you come to me and say, Angela, this is where I'm at right now at this point in my life, this is where I'm at, this is the decisions I've made, and this is where I want to become, I start working with you where you are right now. Exactly. I'm not going to start working with you where you were 10 years ago or when you were at birth, because right now you're telling me you are not in a good space, or you're not in this space, right? You were saying earlier you've never been to therapy, and to the grace of God you haven't lost your mom and things like that. That's probably when you would. So if you ever came up to me right now,
I would, yeah,
you would be in a different space.
Okay.
God forbid something like that happened, right? So good clinicians look at their patient and start working with their patient and where they're at. This is the problem that you coming to me, that's the priority problem right now. Let's work on that problem right now. If 2 days from now you come to me and say, Angela, I changed my mind, I'm like, okay, good, all right. Let's work with whatever you are today, right? Yeah. You're not gonna try to force somebody into a decision, because sometimes that create rift. And if you have a discord or a rift early on with your patient, the alliance is not gonna be therapeutic.
What's your thoughts on PTSD? Like,
a lot more people have it than they don't know about it.
exactly.
So
What is it
that's
exactly?
PTSD.
post-traumatic stress disorder.
Yeah.
And usually to have that diagnosis, a patient or a person would have to undergone something traumatic, right? And then unresolved traumatic over time becomes a cluster of symptoms that would qualify or meet the criteria for PTSD. I think a lot of people have trauma-induced post-traumatic stress disorder, and they just don't know that that's what it is. But they carry on with the symptoms.
How do you know if somebody,
We assess. So usually in order for a patient to have a trauma or a traumatic event, it would have to happen. A traumatic event to them, again.
Yeah, exactly.
This is where I'm saying, because what may be traumatic for me may not be traumatic for you. You know what I mean?
I always thought that was strictly for soldiers like that.
No.
It wasn't. Okay.
No, anybody could develop PTSD or post-traumatic stress disorder.
I don't know, a serial killer, for
Oh, okay. Yeah.
yeah.
For instance, I have a patient who was car accident.
Yeah.
That's actually very common. I have a lot of patients that have that. But I have a patient who was recently assaulted and robbed.
Oh yeah, that can
Coming
mess you
out
up.
of our house.
That can mess you up.
You know what I mean? And now she can't go out in public by herself. She's always looking over her shoulder. That's called hypervigilance, where you're can't be comfortable in public because you don't know what's gonna happen. That anticipatory, you already anticipate something bad happening. The scenarios in your mind. You know what I mean?
Do you deal with a lot of soldiers as well?
I've had some.
Yeah.
A lot of them go to the VA because of the benefits. But I've had patients who were in either discharge or things like that, where they didn't want to go to the VA because of that. But I've had a lot of.
What do they usually struggle with when they get back home?
PTSD.
Yeah.
Unfortunately, a lot of soldiers struggle with getting back into the normalcy. Well, from my experience, getting back to the normalcy of their family.
Yeah, that's what I mean.
You know what I mean? That family dynamics, being gone for so long, and then all of a sudden you're back in your family, and your family's not necessarily understanding the things you've seen, the things you've done, the things how you've lived, and then trying to go back to life as normal.
Yeah, it just doesn't work.
After people go through a trauma, there's no normal. It was whatever is normal to you. You have to adapt to whatever that is for you. And a lot of families don't understand that.
But you're also dealing with the toughest guys that will never show their weakness, really.
Sometimes.
They will, yeah.
Sometimes. I've had patients, again, this is where the rapport comes in. It's all about the connection, right?
Yeah.
I've had patients who are like, wow, you're the first person I'm talking about this to. I don't know why I'm telling you this, but
That's great.
I've had patients say that. It's not in the first session. Usually when they come in, they want to scope up and see how you are. What are you going to do? Are you going to be like your traditional book pusher? I got a guy who was like, oh, I thought you were just a book pusher. Like, what does that mean?
That's a new word.
A book pusher is usually the, people that are so by the book that you have to
Yes.
Oh,
and I'm
okay.
not like that at all. A lot of my patients were
have
having
to
normal,
be. You have to be,
conversations.
Have you been implementing any holistic treatment to any patient?
I don't do therapy anymore in my current job. When I used to do therapy with meditation, To me, that's holistic enough. But not like you're talking about like things like that they could do, like herbs and things like that. I mean, I have patients tell me that they use it, and I always say some of those things, if you're taking psych meds, doesn't
wouldn't
mash.
interfere.
So I always ask for herbs, or I was cultural, nos remediar.
We talk about the
Yeah.
we talk about the grogu for the
Exactly.
for the cold. Yeah.
Nos remediar, like what a remediar are you doing at home that could mess up the medications? Because patients are so quick to say, the meds you're giving me are not working. But then they're not telling me, oh, I'm drinking 3 glasses of wine, I'm drinking grogu, I'm doing, you know what I mean? So all of these things affect how your medications work. So that's why I always ask, like, okay, what other ways are you treating this? What have you tried? Toma banho na areia preto, did that work?
Yeah,
You know?
that's I never heard that before.
Oh, yeah.
That's actually
I
funny.
heard salt.
Yeah, salt.
Salt does a lot.
If you have any pain,
It
go
does
to
a lot of
the
great
urine,
things, though.
and
Let's
you
not
just
hate
take a nice
salt,
I think a
'cause-
lot of it is more psychological
Yeah,
than
yeah,
anything.
yeah.
But hey, our people believe in this type of thing.
Yeah,
So,
yeah.
and this is what the difference is when you're somebody
You
from the
believe.
culture.
Yeah. I always wonder how somebody like you turns off, and says, because, I just go by experience. You go by, like you said, books. You go by, you can see triggers. You can identify this, identify that. When do you turn off and like, okay, it's time to be a mom. It's time to be a daughter. It's time to just be a friend and not like analyze somebody.
Sometimes it's really hard because
Yeah,
sometimes
yeah.
I actually find myself like looking
Mm-hmm.
for
Even the
it.
face.
Yeah, and
She's
then
like a cookout.
it's very hard to turn it off, especially when you see it within like families or you see it within friends. It's initially, now that I'm getting a little bit more seasoned in my work and I know how to separate, it's getting better. But it's hard to turn off like the thinking cap from the clinician side to like a regular person.
Yeah.
For instance, we were just at, I forget where I was, but somebody knows. I tell my family, do not tell people that I'm a nurse. Do not tell people I'm a psych nurse.
They won't want to
Yeah.
talk to you.
Specifically
Yeah,
psych, because as soon as somebody knows that you're psych, they're like, oh my God, you're so needed. My cousin has this. What do you think? Like, and then it's hard to turn off when you're in parties or
That's
like,
tough.
Yeah.
Did somebody ever got mad at you? Like, oh, like, maybe you're just saying that, like, innocentmente, like, oh, I think you should,
Yeah, that's
I don't say that anymore.
Oh, but it happened before, right?
It has happened.
That's
Yeah.
gotta
When
be
I would like, you
Wow, you
definitely
don't say
need
it
to.
anymore?
I don't say it anymore.
wow.
Because honestly, sometimes when you say things that people are not ready to hear,
They'll be mad
you're
at
the
you.
bad guy. So I really try, because in my mind, I'm like, oh, I'm helping them.
Mm-hmm.
The quicker they get help, the better. But sometimes people have to go through their journey to get better,
They're not
right?
ready.
So sometimes if I say things and they're not ready to hear, you're not helping.
They might feel offended. You know.
I
Right.
get
So
it.
I don't
They
anymore.
Judgy. Oh, yeah, supermodel assim, boy, da, 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 you know?
That's why I don't.
Yeah,
It's
makes sense.
really, really hard to. And I have clear instructions for my family, specifically my father. I love him. But don't tell people what I do.
You can't hate on your dad because he looks just like you.
I can't. And I
I'm
love
telling
him
you,
to
our
death.
dad looks exactly
Millie,
like
I'm
her
gonna give
dude.
you a real scenario why I told him this.
Mm-hmm.
For instance, on this recent flight to Cape Verde, we had a woman that had a crisis, and they're saying, "Is there any doctors or is any nurses in the building?" And my dad's like,
All right, yeah.
and I'm like, Papa, you cannot do that. My liability insurance does not cover for things like that.
Oh,
I could
wow.
easily get sued. There's
Oh,
like
so that's like a fake movie thing? I've never seen somebody say, yo, I'm getting sued. I can't touch that person.
No, it's a real thing.
Really?
It's a real thing. I mean,
Because it's not your profession.
it's not, you know what I mean? So I saw the lady, she was having a diabetic crisis. So her sugars, she didn't take her insulin or whatever she was supposed
Sugar's
to do.
low.
And I was like, I said, if she's even having a panic attack, because that's my area, right? I was like, is she having a panic attack? No. And then the doctor came. There was a doctor on board, thank God. And they ended up giving her orange juice and it was fine.
On your field, like, what would you say would be an easy mistake to do? Like, something that, you see
That's a
happen.
great question.
Yeah,
Rookie-
something
rookie
that you see that
mistakes.
happened before. And it's a rookie mistake, but it's easy to make.
I mean, sometimes I can't even say prescribing the wrong things to a patient or having a patient, for instance, right now the huge thing is this opiate epidemic, right? Like that we're on, and you know, a lot of patients have a lot of medications that doesn't mesh well with other medications. So, and they could easily, you know, taken together. For instance, a benzodiazepine like the Klonopin, the Ativins, the Xanaxes that you hear on rap music and things like that. Those medications are highly addictive, and also they're sedatives, so they could suppress your respiratory system, and you could die in your sleep, or you could just go.
Oh yeah.
So sometimes when patients are on opiates, like pain medications, or they're doing other hardcore drugs, and then they're on these type of medications, it's an easy death. You know, it's if you know, so things like that you have to be very careful in monitoring and making sure they're not taking more than they're supposed to, and because your intentions are good and you want to help your patients, but
But the patients, I know as a fact, people they don't always tell the truth. You know
Thank
what I
you.
mean?
Thank you.
No, they don't. Like,
Thank you.
That would make it easy for her. Come
Yeah,
on, you
exactly.
got to make it hard.
Exactly.
even when you go to the doctor, you know, when you go to like just you know, your neck hurts. When you go
Yeah.
there,
Yeah.
1 to 10, how much hurt? 11.
Yeah.
No.
Yeah.
You know.
Yeah.
So people like, cause you know, doctors cannot feel your pain.
Right.
You know
That's
what I mean?
true.
Right.
It's a tough field
It's
that you
tough.
guys
It's
are in.
tough.
It's a tough field that you guys
And
are
then
in.
it's easy when they feel like they're not being heard because or they're not being managed, but you're doing everything within the realms of what you can do. You know what I mean? So sometimes the patients, the more you give, the more they want. The more you give, the more they want. And you can only go so far based on what you can.
I want to talk quickly about Project Health Cape Verde. One of is it your babies, your initiative? Is it something that you just trying to be part of?
So I'm part of the Cape Verdean Nurses Association.
That's
Shout out to CVNA members.
Yeah.
I'm one of the board members, the newest board member, and our goal is to help, you know, Cape Verdeans here, but also Cape Verdeans back home. Every year they do a mission trip to Cape Verde, and where they go and help educate some of the nurses there, support them in their learning.
How's the level?
I haven't gone yet. But every year it's a success, and you know, when they go there they feel like they've accomplished their mission. There's a lot of different things that we have here: technology, medication, support,
That they
you know,
don't
that
have
makes
there.
the life of a nurse here
Much easier,
easier than what they don't have in Cape Verde, right? So the resources, the level of resources. So CVNA, they're always trying to, you know, do fundraising and express awareness or raise awareness to causes like that, and
Nice.
And gather resources for Cape Verde, and also like the education to the Cape Verdean population. So they do a lot. I am happy and you know, kind of proud to be a part of an organization like that, because that's, as a Cape Verdean who've lived both in Cape Verde, obviously here more than in Cape Verde, but when I go to Cape Verde, I see the differences, and I'm like, oh, we've gone a long way. Don't get me wrong, Cape Verde has gone a long way in terms of medical and psychological things, but we have a long way to go.
Do they do internships to Cape Verde at all?
Yeah,
like
they
for
do.
like you, let's say you're a young student and you want to do an internship for a year. Can you?
So I don't know about internships, but the mission trips that they've done with CVNA is that they take students from schools. I know this past time that they went in October, they took a school with them, a couple of students, a couple of nurses, and they weren't even Cape Verdean. Some are Cape Verdean, some are generational, you know, third, second,
that's
and fourth
good.
generation. Right now, where the application is open for the trips, and you know, if students want to come, and they don't necessarily have to be Cape Verdeans if they want to just go for the experience and help and learn and raise awareness. So they do a lot. They do a lot for Cape Verdeans here in Cape Verde. They run scholarships for the students in Cabo Verde.
Nice.
To help them pay for education. So
Shout out to CVNA.
shout out to CVNA. And just to plug, we're having our first community baby shower. We have a couple of maternal health nurse practitioners. So they help new mothers and pregnant women. And they're throwing their first community baby shower in April. And we're proud of it because it's turning out to be in preparation for a great event. So we're trying to be more interactive with the community.
That's good.
That's really good.
That's really
yeah.
good.
Are you working with, above all, Jim right now with any program?
So above all is a gym that I go to, and it's like I call them my fit fam because they're really like my family away from my family. I see them sometimes more often than my family. And again, remember I talked about my coping skills and how I relax and get away. That's where I go and kind of just tune out and work out. And we recently did the suicide awareness walk.
Yes, that was amazing.
The trainer or the owner there, Jay, and myself share, shout out to Jay, and myself share, we've lost family members to suicide, and it's something that we both deeply care about. So I was one of the speakers for the event, and just kind of, again, my mission is, honestly, I just want to educate and advocate for, especially in our community, because it's something that's happening a lot more and has been happening, but specifically now because life is so stressful for everybody. So the gym organized a 5K suicide awareness walk, and myself and one of the social workers who was also a trainer at the gym, Candida. We were speakers at the
You guys
event.
are amazing.
Thank you. I mean, Candida, I don't know if you know Candida, she does a lot.
Sounds
She's
familiar.
way
Sounds
more
familiar.
into fitness than I am. You think I'm in?
Oh, shut up. Can't be.
Oh, you
She
don't know
is,
Candida.
and she's the one that.
I always think that if
this
this
Yes.
profession doesn't work for Angie, she could be a bouncer somewhere. If you see her work out, it's scary.
And again, that's me distressing. So when I go to the gym and
Wow.
I
I
leave
want to see her working out now.
I leave everything at the gym and I go home and I could be a mom to my kids and I could be, what I do at home. So
Sure.
that's how I separate it. But shout out to Above All, they're my fitness fam, and thank you for allowing me to just go there and
No, that's
de-stress.
amazing. I was there and I saw that everybody was really taking a moment to really. It was a awareness for sure.
Yeah.
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 What advice do you have for parents raising their kids? Cobb already asked that, but I want to get a little deeper into that in this social media era, right? Especially in this digital era, because I feel that I have a hard time writing lately because I don't write a lot. Imagine our kids.
Yes.
So I feel that we're getting to a point where everything is going to be touchscreen, everything is going to be digital. So we need to put our kids in front of screens, but when is it too much? When do we need to stop? Do we need to stop? What do we need to do? Because
Honestly, I think that's a question for whatever works in your household, because I struggle with it myself as a parent. My kids are different age groups. So whatever is going to work for Alexa, it doesn't work for my son, Amari, who's, 6 years younger. So trying to figure out how much TV to watch or how much my daughter, it's really hard.
YouTube Shorts.
No, I try not to be too strict because sometimes if you're too strict, they go the opposite way where they're sneaky and stuff like that, right? So she's not allowed on social media. She's only 12.
Yeah.
You know what I mean? Like, she knows the rules. She's not allowed on social media. Is she going to test the rules? Sure, because she's my kid.
She probably has friends who is
Right,
already
and
on
all of
social
her, and
media.
that's what she tells me. She goes,
Yeah,
"Mom,
that's
all of
one
my
thing.
friends are out there, sharing memes and doing all of this, and she's not allowed to have those things." So obviously, when she's coming back to me, and I'm like kind of feeling guilty, but at the same time, I know, and this is where you have to be very secure. I call like a secure parent, right? Don't feel guilty about your decisions. My dad was like, "Oh, you're too strict." I'm not strict. I know how that could influence, especially for girls, the body issues, all of these things that they're seeing on social media. I'm an adult and sometimes I can't filter it.
bullying
You
and
know what I
everything,
mean?
yeah.
So imagine for a 12-year-old whose brain's not fully developed and they're seeing all this I call it make a model. Shout out to them. I'm not, but that's not what I don't want my kid opening up social media feeling some kind of way about herself. And that's why she's not allowed. But I say every parent, every household, whatever works for your household. I'm not here to judge. I just know what has helped in my household, and we don't do social media for our kids.
For our kids, yeah. But I didn't know it was going to be this tough, yo.
Oh,
I
very
worry
intense
all the time
stuff.
about these
No, but
little
don't
light-skinned boys for no reason. I'll be in bed like, oh man, maybe I yelled too much. Maybe I shouldn't have done that.
But that
maybe-
tells me that you're doing what you're supposed to do.
Yeah, but it's
right?
freaking, like, it's stressing, man.
It is.
It's stressing. And then-
Listen, I
like,
agree.
maybe I should. Oh, they've been home all week. Maybe I should take them somewhere. Maybe I should do this. Maybe I should do that. You're constantly like, it's rough.
The
It's rough.
parental guilt is real.
definitely.
But you know how you guys talking about the screen time and whatever. I'll give you an example, right? I see my daughter now when she's on YouTube. She's always watching like you know those, you know the video that it's like a mom and a dad. It's like they're recording each other.
Yeah.
I used to watch cartoons.
Yeah.
They
Kids don't watch that
cartoons no
anymore.
more,
Yeah.
right? And
Oh, like Blippy and them.
like I don't know.
I hate
Milo
Blippy.
And,
Blippy doesn't-
Andy, all the, like,
Tom and Jerry.
yeah.
I just put my son onto Tom and Jerry. He's like, Mom, this is
What is
old.
this? Exactly.
And I hate when they do that.
But that's the thing, though.
Oh my god.
My point is when I'm pretty sure when my daughter it's older, she's gonna be like, we don't do this anymore because now it's gonna come something else.
Exactly.
And for her, it's gonna be like, oh, this is why are they watching this?
Yep.
Because you know everything, especially like technologies keeps going, keeps
Evolving.
going. So
Yeah.
like before, you know, I remember like on breakfast, I'm eating breakfast. I'm reading what's in the back of the cereal.
Yeah, yeah,
'Cause I don't
yeah.
have
That
nothing
was
else to
funny.
do.
Yeah, that was funny. Yeah.
Exactly.
That's it. Now
Now
they
it's
have
a tablet
the
in front of
tablets,
you.
Yeah, la, la, and then you gotta eat. You gotta eat. You know, like
Yeah.
I used to eat quick so I can go watch TV.
Yeah, no, that's true.
You know, now they eat slow so they can be on screen.
That's
so
true.
it's you know
Yeah.
it's
No, I gave up when I showed them Bugs Bunny, and they were like, "Dad, this is whack." I was like, "You,
Yeah.
get y'all."
No, my son legit hurt my feelings when he's like, Tom and Jerry is not
It's
funny. Or
I
not good," or
know.
he was like, it's old because it was like not the HD quality.
Yeah.
Wow,
you
that's
just-
messed up.
you
Give some advice to these young single women out here getting into relationships. I always feel that relationships are like the start of a disaster if you don't choose the right thing. And I think a lot of it adds to the problems that we have in society, especially
Young.
But I see a lot of people making such bad decisions and then talking about their crazy baby mamas or crazy baby daddies. And I'm like, you knew that motherfucker was crazy. Like, you knew. You could see everything. So,
but love.
Right for
Honestly.
sure.
no, loneliness is
It's
tough.
love sometimes. That's the
Again, this is where they're generational because I think you and I are from the same generation.
Yeah.
We didn't have, social media influences.
yeah,
I think social media influences impact relationships way more now.
So much.
It's like
And I-
95%.
95%, right? Right now.
Hey, I'm sorry, single lady. Yeah,
If
yeah,
you
yeah,
don't
talk to her directly.
identify somebody as your significant other on
Yes.
social media, it's like a legit competition, right? I always joke with my friend, like, thank God I met Alex before this whole social media because I don't know how our relationship would be because Alex is not a social media guy. He like looks at it once in a while. Sometimes he's looking at me like, you're too much on social media. But I think social media, the influence on social media, it's made everything so much more superficial and so much more like people are more like disposable. This is just my personal
True,
opinion. I
true.
haven't been single
I
in a
agree.
while, so don't go, it's not book, but I think it does make people more superficial than usually, and people are less likely to work harder when they think they have more options, right?
Yes.
Yeah.
When they think you're disposable and, oh, I could get this one, or I could get or they're comparing what they have, which may be amazing, to the whatever the the superficial portrayal is on the social media, right?
But
'Cause
everything is moving fast
it's
as
so
well.
much faster.
Like, I remember my girlfriends making me wait.
Yeah.
Like, wait for it. And I was like, shit, this is, and it was worth it, but I don't see any
But
of those
again, this is
examples
the
anymore.
Accessibility, because
Yeah.
people are so accessible these days,
guess,
and
right?
when you have, it's like when you think you have too much of everything. It's like, I don't know if this will be a good example, but for instance, I just went food shopping and I bought all different types of cereal. My son, when he like sees cereal, he has to eat all of them,
Right,
just to taste all of them at the same time, just to see which one's better.
Oh, wow.
Social media, like girls,
Yes.
I feel like when men have too many options,
Yes.
they feel like they have to try all of them. And that's why.
That's a real feeling.
That's a good metaphor.
Is it a good metaphor? I don't know.
That's a real
But I
feeling.
feel like,
That's pretty fun.
I think the options, the accessibility is there, and they feel like, oh, if this one doesn't work out, so if they're already going into it like it's not gonna work, they're not gonna put it work.
So,
Yeah.
You know what I mean?
Any app,
So
that's
Angie
why.
said women are cereal, all right? Taste them all. That's what I take from it.
That's a good one. Though.
Oh my
That's a really
If
good
that's
one.
what you got from
That's what I
that,
take from it.
excuse me, if that's what you got from that, you might need therapy.
Nah, I know. Oh, got me.
Like that.
Got
Like
me.
that.
Angie,
God.
thank you so much for coming to the show.
Thank you for having me.
Mm-hmm.
I think one on a final note is the urgency to my capeverdeans to our community. Mental health is nothing to be ashamed about. We need to have these conversations. I know they're uncomfortable. It's not, but it's not the most comfortable topics to have at a family table but I think it's needed.
Definitely.
Especially within family members.
Definitely.
So let's urge our community to take mental health seriously, because
Are there groups that people can join? Not at all.
For
Group therapy,
community.
families together.
Oh yes, there's there's all sorts of therapy groups. There's all sorts of what do they call it? Like Brockton Neighborhood Health Center has different types of groups. You have to be a patient there to access their groups, but there's different things. There's different
quick question:
resources.
Is it part of like the insurance as well, or do you need special insurance or extra insurance to get therapy?
Well, some insurances you have to pay the copay, and that's where the kind of it swayed people because
If you have mass health, which I would say most people.
Mass health usually doesn't necessarily mandate a copay, but if you have private insurances, sometimes it's a copay because we're a specialty.
True.
So that's another thing. If you're already struggling, even though I say everybody needs therapy, but if you're already struggling, you're not going to have the money to pay.
But if you have mass health, that's already big.
But if you have, providers that accept mass health, first you have to find people that accept mass health. Listen, I talk about mental health is needed and therapy is needed, but there's not a lot of us out there providing this type of. There's a shortage because there's so much need. There's wait lists everywhere.
Oh, wow.
And patients get discouraged. Like a wait list to see me is months.
Wow.
It's not like just go and book an appointment. So there's a real need out there.
I really want to thank you, Angie, for coming to the show. I had so much fun. I learned so much from you, and I can't wait for us to have off-camera conversations as well, because those are going to be even better. I am happy that we have people like you. Because as you can see, I would be a disaster if I had. So I'm really happy that we have somebody like you who's patient, who's doesn't judge too much.
I try my best not to.
Doesn't really is really here to help. Because this has to be rough on you. This has to be exhausting, and for you to do that in our community for Cape Verdeans as well. Of course, you're there for everybody, but you're definitely doing it for Cape Verdeans. I take my hat off for you. I would have if my hair wasn't crazy, but I take my hat off for you. I really do. I think you're doing amazing work. I hope that people recognize that. Angela Andrade, thank you so much for coming to the show. We really appreciate you. Thank you guys for watching us. This was an awesome interview, and I can't wait.
Needed.
A much needed one, right? And Angie, anytime you want to come back to the show with an objective, to talk about something, you're always welcome. And we're definitely going to have you here more.
Yeah.
All right?
Definitely.
Yeah,
Next.
For coming.
Thank you for having me.
This was
Fun. This was fun.
Definitely. You guys have a good one out there. Us here at Praçazul checking out today. Thanks so much to Keila for showing up on her sick day. No sick days. Yay. And my guy Gomes, of course. Thank you guys. And thank you to Kalu in the back. We'll see you guys on the next one.
Thank you guys.